Smoking has numerous harmful effects on a person's oral health. In fact, it's actually one of the leading causes of preventable oral diseases, including gum disease, tooth loss, and of course, oral cancer. So when a person smokes, the chemicals in cigarettes, it contributes to the sticky film called plaque that forms in our mouth. And plaque is made up of bacteria that feed on sugars and other substances. And when it's not removed through regular brushing and flossing, it leads to tooth decay and gum disease. And of course, gum disease is a really serious oral condition that usually results from this buildup of plaque and leads to tooth loss. It usually begins as gingivitis, which is that bleeding in the gums. And if it's left untreated, then it progresses to what's called periodontitis. And that's where the gum and the bone starts to pull away from the teeth. And this destruction just reduces the support around the teeth, and ultimately it does lead to tooth loss. Now, studies have shown that smokers are more likely to develop gum disease. In fact, smoking is one of the most significant risk factors for that, and smokers are 3 times more likely to develop it than non-smokers. And this is really due to the fact that smoking weakens the immune system, so then it allows infections to become more active as bacteria thrive. And in addition to gum disease, smoking also increases the risk of oral cancer, as I mentioned earlier. And according to the American Cancer Society, smokers are 6 times more likely to develop oral cancer than non-smokers. And that can affect the lips, the tongue, the cheeks, the throat, and it can be life-threatening. It's very serious if it's not detected early. And so, up to 90% of oral cases are linked to some kind of tobacco use, both smokeless and smoking. There's a lot of harmful chemicals, including carcinogens, in tobacco, and they damage the DNA and lead to the development of cancer cells. So overall, the effects of smoking on oral health are significant and can be devastating. And smokers are just at this wide risk of problems, including tooth loss and oral cancer. So if you're a smoker, quitting is the best thing, of course, to do for your overall health as well as your oral health. Now, smoking also can affect the healing process after dental procedures. So if you have oral surgery, say you have dental implants, you're more likely, significantly more likely to experience infections, delayed healing, and implant failure. And then you think about the cosmetic effects on top of that, on the appearance of the mouth and the teeth. And there's some really specific cosmetic effects from smoking. If you think about it, first is you have stained teeth. It causes this yellow or brown stain from the chemicals such as tar and nicotine. And they can be fairly difficult to remove with just regular brushing, and you may need teeth whitening to take care of that. Then, of course, bad breath. Smoking causes bad breath, known as halitosis, and the tobacco chemicals that get deposited in the mouth and the lungs and the throat can create these persistent odors. And then it can affect gum recession, gum disease, and that can expose the roots of the teeth, which leads to sensitivity and can just affect the overall appearance of the teeth. And then premature aging. Smoking really causes aging to accelerate, leading to wrinkles in the skin, overall kind of a dull appearance. And that's due to the harmful chemicals that affect, again, the DNA of the cells. And we mentioned delayed healing, but if you have delayed healing, it's obviously a health problem, but it can also affect appearance, as you may have more swelling and it can just take longer to get through that. And with oral cancer, if you think about the cosmetic effect, which is fairly minor compared to the other effects, it could lead to changes in appearance if you need to have surgery or treatment that can lead to scars. So smoking has numerous cosmetic effects on, with the appearance of the teeth, the mouth, with all of these different things as well. And quitting smoking can help improve appearance of the mouth and teeth, as well as reduce the risk of oral health problems and other health complications. So the negative effects of smoking on oral health are not just limited to smokers themselves. If you think about it, secondhand smoke can have effect on other people, especially children, something to think about in households. And secondhand smoke has even been linked to increased risk of tooth decay and gum disease in children, as well as increase of oral cancer in non-smoking adults. So, quitting can be difficult, and it's important that smokers have resources to quit. Nicotine replacement therapies, medications, counseling, therapy different things like that. And if professionals can help someone stop, it just reduces the risk of so many conditions. So obviously there's a lot of negative effects from smoking on oral health. There's also a lot of negative effects on overall health, and we want to be able to help people and encourage people to quit. So if you're a smoker, it's one of the best things you can do, but we also know it's very difficult. Now at Express Dentists, we have a trusted network of dentists around the country that we can connect you with. So the dentist can check your oral tissue, teeth, and gums for any smoking related problems, but they can also be an encouragement to help you stop smoking and enjoy feeling better. So reach out. We're happy to help, and we can get you connected for better overall health.